order. Welcome back to the afternoon session of the July 25th, 2017 MDC meeting. I'd like to thank Dr. Jeff Pollard for agreeing to be on the task force with Mr. David Johnson, RVT. So thank you. That the subcommittee, I should say, on minimum standards and protocols for shelter medicine. So thank you to the two of you. We have moved on to agenda item number 7, discussion and consideration of proposed regulations regarding the compounding of drugs pursuant to the enactment of Senate Bill 1193. And there is some language that's there in front of you under tab 7. It's been the work product of Dr. Sullivan, Anne Marie, myself, and Tara. And so at this stage of the game, I don't know if any of those players would like to say something.
I just want to note that if we were noticing this for public comment, which we're not right now, but I just am making the note that this proposes to add a new Article 11 to Division 20 of the Code of California Regulations. So all of this would be new regulation.
Yes, Dr. Sullivan.
Yeah, I would, if I was doing what I'm doing now and looked at this for the first time, that would scare the heck out of me. So I would envision that both the Veterinary Medical Board and probably CBMA would put together a little booklet explaining how to do it, because it's a lot simpler than all of the wording we have here. I do have a couple comments on items here. We're going to go through it one section at a time.
We can go through this however you'd like. I mean, at this stage of the game, I didn't know if there were going to be questions from the committee or the audience, but however.
Why don't you take us through it one section at a time?
Okay, so section 2090, and keep in mind we've been working on this now for a couple years, I would say, and it's gone through 8,000 revisions. So, and also pared down the scope of this. It's important to recognize that what we're talking about is compounding in a veterinary premises. This is for your patients that you see. This is not in any way, shape, or form commercial compounding for some other party that you would be selling the product to other than a client. And this does include both sterile and non-sterile compounding. So those are the aspects of what we're dealing with here. Section 2090, the definitions of compounding. This is a definition of compounding that we've seen before, and this fits neatly with the definition of compounding that we see in the Pharmacy Practice Act as well. We do use the term expiration date in our language. Beyond use date is used in a lot of Board of Pharmacy literature, but we're trying to stay consistent with the terminology that we know. So that's 2090 definitions. 2091 veterinary drug compounding does talk about the veterinarian shall ensure the safety and efficacy of the compounded drug. Shall not perform the drug compounding when the complexity exceeds their knowledge, facilities, etc. And then it talks about sterile compounding and how it must be for immediate use unless, and then it has a dilution of the ingredient is essential for the safe administration of the preparation. I think that we've been talking about various mixes here today, and many of us have a pre-medication or a tranquilizing mix that we may use prior to surgery, where if you had to draw up that minute dose for every cat, it would actually create, the risk of creating a medication error would be substantial. So there are no other human or animal drugs that satisfy the need of this preparation, and there is a historical documentation of the need, safety, and efficacy of the preparation. So that's 2091.
John?
Yes.
Item B is kind of wordy. I mean, I know what it means. I think when we look at the items that we are compounding, they're really very simple and straightforward. And it is, I'm still wondering if we should reference the definition of simple compounding, as that's referencing, what is that, the pharmacopoeia.
Yeah, it is.
I just, I think that might be a little vague, but I don't know. I think the selling point here is that it is very basic compounding. It's not using complicated equipment or measuring devices, and I don't know if this says it. If we're comfortable with it, then I'm fine, but I think we can pin it down tighter if we wanted to use a definition in the pharmacopoeia.
Do you mean, Dick, that there would be examples of what simple compounding is?
No, the pharmacopoeia has three types of compounding: simple, can't remember the second one, and complex. And simple is, and they use sodium bromide in veterinary medicine as their example of simple, but there is a definition for it. We originally had it, and then we kind of backed off it.
Yes, Anne-Marie.
I think that we moved away from using pharmacy provisions and USP language because we were trying to not look like that. We were trying to make this distinct from the complexity of being a pharmacy and a pharmacist and the complexity of following USP. So the more you bring that into the fold, the more you invite it to look inconsistent, you know? But I think we can improve this so that it's more clear without referring to a USP definition.
Okay.
That would be my recommendation.
I'd say there was just one other concern with cross-referencing the USP was that I think it's currently under revision. I want to say it's like the section 500 where the simple and complex definitions are located. So it's difficult for us to, rely on something that's currently under revision, and then we'd have to keep coming back to this as that continued to be revised.
I just want to make sure that that's not a loophole for somebody doing something beyond what simple compounding is, and our intent is to make sure that it remains simple.
So you're talking about 2091B here? This is the complexity?
Yes.
Okay. I'm trying to remember if simple compounding did not include sterile. I'm wondering if was sterile part of that or not?
I have to go grab my notes,
Yeah.
but I can't. You know what?
So while they're looking that up, any other questions at this point?
I just have a note that simple compounding referred only to non-sterile.
Yeah, and that's what I had remembered, yeah. So I think that's why, based on how we had organized this, Dick, I think that's why we...
It's simple, moderate, and complex are the three. We can look at that wording and see if there's any need to add anything to it, but I understand why we didn't reference it now.
Another thing to note is I think we were trying to recognize that veterinarians have been doing this for a really long time. So to the extent they're already compounds that are being prepared, veterinarians have a pretty good idea at this point what they're doing and what's beyond their scope of experience. To the extent they start to branch out away from the safe preparation of that, then board inspectors would be able to go in, because I think that's really the point of these regulations, is to provide guidance for enforcement, so that, the board can have an idea of what veterinarians can and cannot do. So to the extent an inspector goes in and sees that hazardous compounding is going on, that would be something that the inspector could point out, could research with respect to the veterinarian and their level of training, as well as the facilities themselves, whether or not they're capable of compounding hazardous medications. So we're trying to, I guess, maybe just find a balance between what veterinarians are already doing, and also keeping it out of the complexity of the pharmacy regulations, which arguably are unnecessary in these circumstances, because they're for smaller amounts. It's not going on all the time. It's better defined in this regulation for those times that there isn't some other medication that's already prepared that would treat the same issue. So I think, generally speaking, we're trying to provide an adequate enforcement mechanism while recognizing that veterinarians are doing this largely in safe ways.
Okay, 2092 Policies and Procedures does discuss the quality assurance program, the preparation of the master formula, kind of breaks down all of those documents, and the record keeping essentially, and additionally it carries over onto the next page, the training, supervision, and then the storage of the medication. So policies and procedures kind of encompasses all of that. Yes, Dave?
Getting away from the pharmacy side, board side of things, I think we should remove the word master.
Okay. Just a formula document.
Yes.
Okay. So I see that on 2092B, I see the word master.
B, C, and D.
Okay.
I think it gives a connotation of a complexity that really isn't there.
Yeah. Okay. Other comments? 2093 expiration dates. And so there is, here at C, we have still a blank that we need to fill in. But we've got, for non-sterile compounding, 180 days from the date the preparation is compounded, or the shortest expiration date of any ingredient in the preparation. And for sterile compounding, 30 days from the date of preparation is compounded, or the shortest expiration date of any of the sterile ingredients. And then C is an opportunity to extend an expiration date. Yes?
The expiration date may be extended if you can document the safety, sterility, and efficacy of the product.
The expiration date may be extended if the safety, stability, and efficacy of the product may be documented.
Yeah.
Or you can say integrity, potency, and quality. Those are the other terms they use when they talk about the stability studies. Integrity, potency, and quality. It just depends on what makes more sense for veterinary medicine.
I'm wondering if, when I read that, I think that's also true of non-sterile compounding too.
Mm-hmm.
Maybe it should be
So C could apply to either A or B. It doesn't, C doesn't follow
Okay.
under, and I think John pointed that out, that C being left independent of A and B means the expiration date of any drug may be extended if, yeah.
I think it's easier to demonstrate it on non-sterile products than it is sterile products.
So we've got two different serving suggestions, language-wise, safety, stability, and efficacy, or integrity, potency, and quality.
I don't know the difference.
I think if you're talking about IV, I think you also have to have sterility in there.
Okay.
Well, we don't have stability or sterility on any of these, do we? Do we have, I thought we had safety, stability. Was it sterility?
I had sterility.
Okay, I
For the
misheard you.
For the IV.
Okay.
So read safety, sterility, and what was the last one?
So the expiration date may be extended if the safety, sterility, and efficacy?
Yeah.
Okay.
So efficacy is an odd thing to put for the drug. I would say you're looking at the quality of it or the potency of it. Because over time, what you're worried about is that it's decreasing in potency, right? If the drug expires.
The efficacy decreases.
Does that mean the same thing?
Well, but, I mean, isn't efficacy, if you're using the wrong antibiotic,
Yeah.
it wasn't efficacious,
Right.
so.
I don't think efficacy is good for this
Okay,
drug.
it's-
I don't know that efficacy.
That's fine with me.
And then, when we talk about integrity, is not sterility included in integrity?
It is.
My concern with efficacy is, I mean, what happens if you gave something that didn't work?
It doesn't mean that the drug's
It-
expired,
yeah,
it
it
just
doesn't have
didn't
anything to
work
do
for
with it.
the.
You gotta try something new. Doesn't always
So,
work.
it sounds like integrity, potency, and quality may be
It's fine
a
with me.
better triad.
We have three.
Yes.
Don't care about the words as long
Yeah.
as there's three.
Mhm.
Oh, boy.
Okay. Anything else on 2093? 2094 labeling, basically will conform to 2032.2, it's already in the Practice Act. 2095 quality assurance, so this does talk about the quality assurance programs within a particular practice. And then 2096 is the inspection authority, which rests with both the Board of Pharmacy and the Veterinary Medical Board. Okay. Comments, questions from the audience? Right, so are we at a point where we can make a motion to send this up to the board?
So moved?
Okay. Got a motion, do we have a second?
Second,
Discussion?
question. The BUD that you indicated in 2090 that you want to stay away from just because of, connotates more pharmacy language. Does it change anything in practice if we say BUD versus 180 days or 30 days or whatever?
Does it change anything if you, within your practice, refer to it as a BUD?
Right, because most people in our world aren't going to know what BUD means.
That's why we're using the term expiration date.
So does it have the same meaning, I guess?
Mhm.
Okay. Okay.
Okay, so,
How the human side of compounding defines it and uses it all the time, and, you know, our software doesn't have it, so we'd have a big problem there, so we're just defined expiration date as our BUD.
So we were clarifying again, just very quickly, 2093 the expiration date C. The expiration date may be extended if the product's integrity, potency, and quality can be demonstrated. Okay.
Can be demonstrated. We'll work on that a little bit because I think when we met with pharmacy, the exception here is if there's data. So if there's documented, verifiable data that,
We did have an example
Yeah.
of
yeah,
sodium bromide. You can,
Right.
patient isn't having seizures and we can do blood levels. That's documentation that can go beyond.
right. So I think we need to state that. There's
Okay.
documentation, there's history, there's data to suggest the potency, quality, integrity, potency, and quality is not compromised or is demonstrated at a longer expiration date.
We'll leave
So-
that up to the,
Okay, we
Work
need to
people.
work on that section. Okay.
we'll get a chance at it next time around anyways.
So to be clear, are we trying to find a way to specify what will satisfy, what actions will satisfy?
You know, you have 180 days, and if you go beyond that, then in your formula or in your document, you have to document that it is not efficacious, it is,
Yeah, integrity, potency, and quality.
yes, are measurable, and you have it documented.
So perhaps, I mean, throwing this out there, I'm trying to, keep this ball rolling, so we can get it up to the board. The expiration date may be extended if the product's integrity, potency, and quality are measurable and documented.
Yeah,
Fine with me.
you guys can wordsmith it on the way. We'll have another look at it at the board,
Okay.
but you know what the intent is.
Okay, so we've got a motion and a second here on this language. Any other questions from the committee at this stage? From the audience? So I think we're ready for a vote.
Okay. Sorry, let me get my page here.
So all in favor of accepting the motion?
There you go, call the roll. Dr. Klingborg,
Aye.
Dr. Pollard,
Aye.
Dave Johnson,
Aye.
Christy Pulowski,
Yes.
Diana Woodward Hagel,
Aye.
Jennifer Laredo,
Aye.
Dr. Sullivan.
Yes,
Great, motion carries. Agenda item number 8, discussion and consideration of proposed amendments regarding drug information to be provided to clients. So we had considered language at our previous meeting, and then there was SB 546, so we sort of suspended our conversation so as not to duplicate efforts. And then SB 546 got parked in the legislative parking lot and didn't move forward. And so here we are with language that was arrived at through a number of parties, but if you will remind me, Anne Marie, of how this language came into existence.
Okay, so a little bit of background. 546 was the attempt to legislate this, and we had started down the regulatory path, as Dr. Klingborg mentioned. We had worked on this a little bit at the MDC level and had a subcommittee and had some language, and the subcommittee was Dr. Sullivan and Dr. Pollard. And then we met with the author's office, Senator Hill, and his chief consultant, CVMA, was there. We did get some feedback from the university. I believe UC Davis provided the author's office some feedback. And along with the proponent of the bill, Solomon Stoop, who brought this issue before the Senate committee. And we arrived at this language as a reasonable middle ground during legislation. So I was there to try to communicate some of the board's comments, the MDC's comments on how we could practically implement something like this to ensure that there is some level of conversation or communication with a client, but also that we're not holding the veterinarian accountable for drug information that is either not available or they don't know at the time they're prescribing the drug because it's just something that there hasn't been a history of either adverse reactions or complications documented. So again, this was the negotiated language. 546 did not move forward in the legislative process, and due to that fact, the chief consultant of the committee asked that we revisit this as a regulatory action as opposed to something legislative. And I believe that that was the desire of this committee to begin with, is to keep it in regulation, because then as things change, as this information evolves, we have an opportunity to address it by regulation without going back to the statute and changing statute, which we know is not always the easiest path to take. So a couple of notes here that I want to tie together because I think it'll make sense in terms of how this was agendized. When we originally started talking about client communication in terms of drug counseling, the conversation really stemmed from, is this part of the VCPR, right? It's part of your client communication. You have to establish a VCPR to prescribe a drug, and you prescribe a drug, and you're communicating with the client what the intended treatment plan for that animal is. So you'll note in the agenda, section 2032.1, I believe, is referenced, and that was a little confusing because this isn't necessarily VCPR language, but it's client communication language, right? So we really haven't decided where this is most appropriately placed within the Practice Act. Dr. Klingborg and I had a conversation about, really it should be probably better suited under written prescriptions because it follows writing a prescription, then providing the consultation. So those are the mechanics, which is separate and apart from the actual text, but I just wanted to tie together how it was agendized and what you're seeing today in terms of a consideration. I did not change any of the language. The subcommittee didn't change any of this language from what was negotiated during the time that SB 546 was still in play. So what you're seeing is the actual negotiated document. And now it's open to the committee to review the language and ask questions and see if this fits.
Comments from the committee?
Well, I guess I'll start out. I think there are multiple problems with it.
Okay.
Almost too many to mention.
You want to try a couple?
Okay. Will do. In no particular order. Offer to provide in A, shall provide in B. Offer in 2A. So what is it? What is a veterinary drug resource information? That's in quotes, and that appears every place. What is an authorized representative? Authorized. What does that mean? I don't like the shall, the mandatory. I think there should be an acknowledgement that the veterinarian has discretion based on the circumstances known to the veterinarian at the time. I think it omits a very important issue, in that what condition is the drug supposed to treat? I don't see that anyplace. It was instructive to me that whoever assembled this agenda item had the pharmacy board's consultation requirements, which actually seem to be more less complicated, shall I say, than those presented to us here. So I'll start out with that.
Okay.
I probably have some more, but that's what comes to mind right now. Oh, special directions, special directions for proper use and storage. dangerous drugs doesn't include controlled substances.
Yes.
Okay, so let me answer a couple of your questions.
Okay.
Dangerous drugs is defined in the pharmacy code as any drug that requires a prescription, so that includes controlled substances.
Oh, okay.
So that's a standard definition.
Okay, well, I didn't have 4022.
Yeah. Veterinary drug information is actually, or veterinary drug resource information is actually the reference to what Plums uses, which is the veterinary drug Bible, if you will. So in your packet, there's also, I think it's a sample of what Plums provides to a client or to even a veterinarian, and they consider this veterinary drug resource information. So that's a standard term, I guess, in the veterinary world. And then shall offer. The reason we came up with shall offer is because the client can refuse. Can say, hey, I don't need the consultation. I've used this drug in the past with my animal. Similar to what a human can do at the pharmacy is they can say, no, thank you, I don't need consultation. So shall offer means that the veterinarian has an obligation to at least offer it if they know it, but they don't have to provide it because the client can refuse that consultation. I think those are all.
It says shall provide in 5B. Oh, and I have another comment. 5D is just so darn wordy, and it injects other electronic means into the proposal, sort of out there. You know, I guess the idea is okay. It's just so unfocused.
An authorized representative is just a term for anyone who's under the supervision of the veterinarian.
Oh, I thought it was
This is
the client.
Oh,
Yeah.
the client's
And,
authorized
you know,
representative.
it's kind of a trap for the unwary. What's an authorized, representative?
I
I,
believe
I,
the Practice
I
Act
just-
calls it an agent.
yeah, exactly. Well, that makes more sense.
Yeah.
It's one of those regulations that you see that almost anybody can run afoul of because it's so wordy and complicated. And if anybody wanted to make an issue of it, they could, because it's just too unfocused and wordy. That's just my feeling as a public member. I don't know. I defer to people who are affected by this.
Well, simply put, I think that it goes beyond what a human pharmacist or pharmacist that's,
Right.
that's administering for people. And that's my issue is, I'm all for level playing fields, but,
And disclosure.
you know,
Why was condition omitted? I mean, you want to know what it's for, don't
well, I'm not sure that actually is on the human side either, so,
But-
you know. Other comments?
In addition to your comment, Dr. Klingborg, about going beyond what's required of pharmacists, it goes beyond what's required of physicians. Physicians, I rarely see in a scenario where they have to describe pharmacy counseling in the context of a document like this. They defer that to the pharmacist. So they're off the hook, so to speak.
Right, or we
you? Well, now that you mention that, I did ask my pharmacist, because they dispense veterinary drugs,
Right.
and I said, what's your protocol when you're dispensing to a client who's coming in for their animal? And he said, well, we follow the pharmacy board.
Yeah.
Right.
Yeah. So why should a veterinarian be held to a higher standard, except for the fact that they have prescribed it? But it also includes veterinarians who furnish, just like a pharmacist.
So we're going to approach this language in a couple of different ways. We're going to approach it with what we don't like, and then we're going to talk about what we do like,
Okay.
okay? So that we can try and sort this out. Yes, Christie?
Well, I was just gonna say, I don't disagree that we all have, I think we've all said, we need to make sure that we do a better job, and I think that that's our goal. But I think that there's a way of condensing this language to make sure that we can do that without having it be, you know, over a page and saying that we need to make sure that veterinarians do a better job educating their clients without having it be a page of mandates, of saying what those requirements are and listing them individually. I think there should be a way of saying what is required without saying over a page of mandates of what we have to do and what in every single little detail spelling out what we have to do.
Other comments? Okay, public comments.
Well, my first comment is the same one that I brought up at last meeting, is that even this language is not clearly just directed toward outpatient. The very first A needs to say something like, each time a veterinarian initially prescribes blah, blah, blah in an outpatient setting. Because if you read this wording, this could apply to every drug that's initially administered to an animal while it's hospitalized. And even Mr. Stoop agreed that that's not what he was intending. And then CARFTA has some concerns about allowing veterinary assistants to be the ones doing the consultation. We don't think that they have the training to be able to discuss pharmacology things with clients. And then we also had a question about what about extra labeled drug use? Extra labeled drug use, drugs for which there is no official literature about how they're supposed to be used.
Other comments? Okay, well, this has come back to us from the legislature, so we're gonna slog through it a little bit here. And let's go through it paragraph by paragraph at this point. I think that it's been pointed out in A, that there needs to be an addition of, furnishes a dangerous drug as described in 4022 to an animal patient, and then somewhere in there, in an outpatient setting. The veterinarian shall offer to provide the client or his or her authorized representative a consultation that includes the following: the name and description of the dangerous drug. You can read 2, the route of administration, dosage form, duration of the effects, etc. 3, any special directions for proper use and storage. 4, actions to be taken in the event of a missed dose. 5, if available, precautions and relevant warnings provided by the drug's manufacturer, including common severe adverse effects of the dangerous drug. And that fits pretty neatly right there, I think, with what we have in 1707.2. So at that point, we still seem to be being held to the same standard.
Does it have special in it?
I don't think it said special. Well, any special directions for use and storage, I'm sorry, yes. So it is there under D3 of 1707.2.
But, okay,
Christie?
so it says special directions.
It
What if it's
says,
just regular directions to stored on your counter?
it
stored?
doesn't say anything. The directions for use and storage, so under C1, the directions for use and storage and the importance of compliance with the directions. Okay? And then under D3, any special directions for use and storage. Okay? But that is, when a pharmacist deems it is warranted, that the oral consultation shall include that. Okay? So again, that does not seem to fall, that fits very nicely with 1707.2. Now, the veterinary drug resource information, this is not free service. So the group that writes this formulary plum that's been referenced, that's between $75 and $85 per doctor per year within a hospital setting to have those kinds of drug monographs printed out. I mean, a lot of this stuff you can get off of drugs.com or some of those other things too, though it may not be veterinary specific. But there's also the point about extra label use drugs. I mean, if we're using a drug for puppy mange, for example, demodectic mange off label, there's not a handout we're going to be able to reference with that. Yes, Dick?
Well, that's covered with the if available.
I think B should be eliminated completely.
Which,
B.
So is when available then, are we comfortable then that gives us the flexibility we need?
No, I think B should be eliminated. I'd like discussion on that from the people that are affected by it.
we're talking about 5, I think, number 5.
5, but 5B, yeah.
Oh, I'm sorry.
No,
Yeah.
B.
5 is under A.
Oh, sorry, yes, you got it, yeah.
So I think I don't know of too many people that are going to use an extra label drug that aren't using it under the experience of a specialist or an expert. I mean, we're not out there doing it on our own.
Right.
So it isn't coming from the drug manufacturer, so it's not going to be available to them from them. So I think we're covered.
And it's perhaps a drug resource isn't available.
Right.
Because it's extra label, so.
Right.
So again, I think that this does put us on the same level as the pharmacist who does hand out paper with the prescription. This is what we're talking about.
I do understand that.
Yeah.
I think B is unnecessary in the context of all the other required disclosures. And I'd like comments from the people who are affected by it. What does CVMA think about it, about B?
So, question, Diane. So, 5B is,
Sorry, it's 5 zone. A1 through 5.
B.
Yeah.
Is the objection the shall?
No, the objection is veterinary drug resource information, which I've just heard is a subscription service. In addition, it's a private subscription service, in
Right.
addition to manufacturer's instructions, the expertise of the veterinarian who is prescribing this drug. Why? I don't get it. You've got an oral consultation, you've got a number of disclosures. Why? Even if it's permissive, why?
Jeff,
I think it just adds to the verbiage that's unnecessary.
Jeff and then Dick.
Okay, to follow that then, there are other sources of drug information, right? Things that, there was reference made to online sources, lay site sources. The value or the depth, the degree, the accuracy, all those things could be argued compared to, let's just use plums for a moment to describe this phrase, veterinary drug resource information. Clearly a common and not superior, at least very good, and as John pointed out, clearly expensive. It changes every year too. And what if the veterinarian wanted to provide said information and it wasn't from that source? Would it be deemed inferior or even unacceptable? There are lots of, the other, as a side thought, the other comment I wanted to make referred to off-label use. Sometimes, well, many times, the things that we use are off-label. Most veterinary drugs are not labeled for veterinary patients, number one. And sometimes the definition of off-label is the dose. Gabapentin is got a neurologic effect at X dose, and at Y dose it has maybe an analgesic dose. It has side effects that maybe vary from both patient to patient and certainly from animal patient to human patient. So some of the sources of the drug information that weren't from plums wouldn't be as helpful, would even be wrong. Anyway, initial thoughts.
I would say personally, if I had a client that said, I want documentation on that drug, it gives me a warning that I better be explaining things better to this client. I think it's fine. If somebody wants more in-depth information on this drug, I think it's my obligation to provide it.
Is it your regulatory obligation?
Oh,
You want to impose this on other veterinarians
Well,
instead of in their discretion?
Do you guys realize you're providing her with, she's asking that she doesn't want it in here, and you both just explained to her why it shouldn't be in there?
It should be in there.
Should.
But you're saying it should,
Flame.
yeah, that you need to provide more information. I mean,
Provide it to the client, and I need to explain better than what I have in the room.
yeah, I guess I'm confused. You guys have confused me now. Because the way you just said it, I think, is what you confused me.
I understood what Dr. Sullivan to say was that if a client explicitly requests more information on X drug, that's a flag to him that he certainly wants to make sure he gives this client information on X drug.
Right, but like she said, is it a regulatory obligation? You said, because you said, is it, I should have provided her more information.
Yeah.
Do you understand my confusion?
I actually think it, no, I think I understand what he's saying, that he believes that as a veterinarian, if his client is seeking to understand what the drug is going to do for the animal, to the animal, and to cure whatever he's trying to cure, that he should provide this, and that yes, that should be an expectation, almost like a minimum standard of care or standard of care. Diana, I understand your concern about imposing such, it seems like very specific rules to the veterinarian. So right now, the regulations are silent on this type of communication. And different from human medicine, where you're right, the doctor has an out because they don't necessarily dispense to their patients. They could if they have samples, but usually they're writing a prescription, goes off to a pharmacy, and the pharmacist is providing that information. There's very little drug literacy for animals at a human pharmacy. So you're right, they will offer to provide you information about the drug, but they don't know how it's going to affect your animal because they're pharmacists, not veterinarians.
Right.
So it does rest here. We regulate veterinarians. So regardless of whether you go to a human pharmacy to get those drugs filled, they're not going to be able to talk to you about what that drug does for your animal. And I think it's important that we say if there's literature available that a veterinarian can provide it, we're not saying you have to if it's not available. But if it's available, you can provide it. Because there are studies done. Dr. Pollard shared one with me. I've seen a couple of studies on health literacy. They hear very little of what you're saying to them at the time you're treating their animal, especially if the animal it's a serious health condition and they're worried about the life and ongoing care of their pet. If you can provide them with documentation that they can read at a later time or at least take home and try to absorb, chances are they may get a little more information than they heard you saying to them in the office when they're trying to make a multitude of other decisions, financial and otherwise. So I don't think this is onerous, my own personal opinion. Veterinary drug resource information, you can call it whatever you want. That's just a term.
Well, if you're saying that a client should take home written information, which I understand. Well, say that. Because I still don't understand what this adds after precautions and relevant warnings provided by the drug manufacturer, including common severe adverse effects, the expertise of the veterinarian. If you want to bolster that with something written, the veterinarian will say so. I don't have a problem with that. What I do have a problem with is this veterinary drug resource information when available.
It's just a term.
If
So you can
It's
say
it's
written
just a term
documentation.
that I don't understand, except that you're saying it's plums, and all you.
Well, that's an example, but I'm saying veterinary drug resource information could be any documentation about the drug.
Then-
It's just,
Then say written information regarding the veterinary drug.
okay.
Because as a public member, just reading it, I don't understand it. And you've segued instantly into a subscriptions, or not you, but I guess Dr. Holder did, into a subscription service.
So Diana, if we were to rewrite this to say, a veterinarian shall provide written information along with the oral consultation if this information is available and is requested by the client or his or her authorized representative.
Well, why don't you say, a veterinary, if requested, comma, the veterinarian shall provide, written information about the information stated in the consultation period.
If requested, a veterinarian shall provide written information, period,
Written.
When available.
when
Well,
available.
it doesn't have to be when available. If it's the oral consultation, they're saying this, A, B, and C. Write it out. Write it on the back of an envelope. I don't care. It doesn't have to be formal. If the concern is the client wants more or specific information, and I get that.
I think the when available is not so much about the
I-
actual documentation. Wait, and hear me out.
Yeah.
If available means information about some of these things may not be known because it's just not available about that drug for use in animals. That's when available.
Well,
It
then-
doesn't,
Say
it-
that.
we are, it just, you're not understanding it. So
All right, well,
I think that's what they're saying, is
Good.
that if requested, the veterinarian shall provide, we could say written documentation regarding the veterinary drugs when available, or when the information is available. I mean, we can wordsmith it, but that's the whole point of this. If there's documentation about the drug in terms of side effects, precautions, so on and so forth, and the client requests it, the veterinarian provides it.
there you go.
Okay.
That's fine.
Great.
I get that. I
Okay.
don't get veterinary drug resource information.
Okay.
Good point. So are we good with B at this point? As rewritten, as amended?
You want to say it
Okay.
again, please?
I'm sorry, what?
Could you repeat it?
No. If requested, a veterinarian shall provide written information. Yes, Val. And there was something about its availability.
So I realize you're saying written and not printed, but I think the implication is that it's printed. And in this day and age, I do not want a pile of paper this long being handed to me. Email it to me, you can text it to me, you can give me a website, you can give me a link. But to me, you're implying that it has to be printed, so I would ask you to be very careful about what you're saying.
So what should we say?
I don't know. I'm just saying that most people do not, when I go to a pharmacy and they hand me documents this long, you know where it goes?
Yeah.
In the garbage can.
Written
So-
or an e-document.
We agree with the premise, but I think you have to be careful how you word it.
Or
Yes.
electronic.
I think you could say documentation. Because documentation covers both handing it to you or emailing it to you. It's documentation.
You could also provide for that under D, the consultation or written documentation may be provided
Mhm.
through other electronic means.
Mhm.
So if requested, a veterinarian shall provide drug documentation if available. talk about C. A veterinarian may delegate the task of providing the consultation and the veterinary drug, and let's just say, and drug information to a registered veterinary technician or a veterinary assistant who is employed by and working under his or her supervision. We've heard from Nancy already that she thinks that should be RVTs or DVMs. Where are we with that and how this stands?
Yeah, I think we need to leave the veterinary assistant in there because it may simply mean going to the computer and printing out a Plum's explanation or another drug company's explanation.
Yeah. Yes, Christy?
It could also just be flea medication. I mean, it could be anything that you're dispensing, so I think a veterinary assistant can, we have to leave that at the discretion of the veterinarian to determine who goes over what.
Yeah, what drugs we're talking about. Okay. Yes, Dave.
Do we want to, I'm going back a little bit here, or authorized representative, do we want to change that to agent?
Agent, yeah.
Yes.
Yeah.
Globally change
Yes,
that?
yes,
Okay.
yes.
So we'll change agent in all areas.
It's sort of surplusage in C, to say who is employed by and working under his or her supervision. Isn't that pretty much implied in the circumstances?
So the veterinary may delegate the task of providing the consultation and drug information to a registered veterinary technician or veterinary assistant,
Period.
period. Because they are already under supervision. You're not gonna have some random assistant do it, are you?
Off the street.
Yeah. Is that not sufficiently clear?
It is to me.
So, because we got into this whole discussion in other areas about who can be employed by and working under, and everybody qualifies as a veterinary assistant, that's not otherwise an RVT or a veterinarian or a VACSP. It's cleaner to do this because we have other things going on in other areas of regulation that this ties it back to under the same premises, employed by, if you referred a client out, and that client had that pet, you prescribed a medication, client was also seeking ancillary services for that animal, you wouldn't want someone else that's not your RVT, your veterinary assistant, providing the drug information. Chances are it's not gonna happen, but I think some of you know where I'm going with this. This makes it very clear that those people are working under your supervision who are actually counseling your client.
However, it's an active delegation. Veterinarian is delegating. So that sentence implies that the veterinarian is ultimately responsible.
I don't disagree with you, but I don't think the latter part of that sentence changes anything.
Well, it makes it less brief, but it also makes it quite specific.
Yeah.
So if we can live with it, let's live with it and keep moving forward.
Can I just make a note that at the end of that sentence, his or her supervision is a bit unclear insofar as his or her at this point is referring to veterinary assistant rather than veterinarian.
Oh, yeah, you're right.
So we could just change that to working under the supervision of the veterinarian.
Well, it should probably say a veterinarian may delegate to a registered veterinary technician or a veterinary assistant who is working under his or her supervision the task of providing the consultation
Yeah,
and drug information.
yeah. So just reorder it.
Okay, D is the consultation may be provided to the client or his or her authorized representative, which we've changed to agent, in person or through other electronic means by the veterinarian, RVT, or veterinary assistant. And now we have this, who has access to the patient's animal records. So now we've got this new variable.
Which is weird, because it makes it seem like it's maybe not within the same employment situation.
Right, could be a different building or something
Right.
almost.
I think we need to remove other, don't we?
Other electronic means?
Yeah.
No, I think here is where we were gonna add the consultation or documentation may be provided to the client or his or her authorized agent in person or through other electronic means, meaning that they can email it to them, they can,
Right, but other implies
Meaning
that.
by other means or by electronic means, not both.
or through, oh, I see what you're saying. So just remove other because then it means it's either or instead of,
Yeah.
gotcha.
Mhm.
So, or through electronic means.
By the veterinarian, RVT, or veterinary assistant, and I think you strike who has access to the animal patient record, because when wouldn't they have access? Is there a point in time when the RVT or the veterinary assistant wouldn't have access?
If they're at another facility.
But if they were acting under the supervision of the veterinarian and he said, Jane, please send metronidazole information to client Jane Doe, doesn't seem like a violation.
I think we do want it there. Isn't that the language we have on the dispensing, the new
Yeah, but
regulations on dispensing?
I'm
They have to
wondering
have
what it
access to
adds.
the records.
It may be important because the consultation piece requires more patient-specific information rather than just drug information. So if it's just drug information, they wouldn't need to see the client's records. Please provide methimazole information, blah. Send that, great. But as far
Oh, I
as
see.
meeting the consultation with respect to this animal and the dosage being prescribed to this animal, probably requires access to the records.
Well, that would fit with what F reads. In fact, what you just stated is a very good summary of F. Consultation is
I
provided.
changed my opinion on this. We're giving out information, we're not giving out the drug.
Yeah.
So you're saying that you should strike it?
Well, I don't think we need it. I don't think it hurts to have it there, but I don't think we need it. If the medication is going with it, yes, but if this is just information on the drug, I don't think you need access to the.
To the record.
Right.
Yeah.
Why don't you just put this in A?
Yeah.
Just say consultation in person or by electronic.
So one suggestion has been that we take the consultation piece here that we're talking about in D, that is in person or through electronic means, and we just take that phrase
Yeah.
and we move that up into A, where a consultation in person or through electronic means will include the following information. Works?
And you're moving then by a veterinarian, registered veterinary technician, or veterinary assistant?
No, because that comes in later. That comes in later. You don't need it.
Oh, you say you can delegate it?
Yeah, you can delegate it to C.
Gotcha.
Okay, so then we would strike D because we have encompassed that.
And I heard authorized agent, but an agent is an authorized person, so I don't think we need the word authorized, preceding agent.
Okay. E, if a
I think-
consultation is refused by the client, the facts shall be recorded in the client's record.
I think there's some way that we should be able to combine E and F. The request or refusal of a consultation shall be noted in the chart or in the medical record.
You know, I don't see on the human pharmacy 1707.2 any requirement of notation. I mean, yes.
I agree. This is common sense medical record keeping in that it shouldn't be a requirement. It should be, if you're going to keep proper medical records and you want to make sure you do this, then you do it. I mean, yes, you should. You should absolutely do it if they decline it. But, I mean, it's record keeping. This is part of record keeping. If somebody declines something, you put it in your records. But do we
What if they accept it? What if they request it? If you didn't put it in the record, you didn't do it.
I know, I don't disagree, but it's the same kind of thing that, yeah, it's still providing care, and it's the same thing that you do when you provide care. You put it in there, and you put it in your medical notes that you discussed this in a consultation. That's part of client education, in your medical notes.
No, but it's not spelled out as other items are. And the bottom line is, if it's not in there, you didn't do it.
How about if you're smart, you'll document, you'll document the client's refusal, period.
Jeff?
I don't think there's any, I mean, just thinking about the way practice works, I can't think there's many situations where the veterinarian wouldn't document a refusal for obvious reasons. But it does create a bit of a, maybe onerous is too strong, but every single time I say, please take 2 aspirin and call me in the morning, I have to write that down. That doubles the amount of, transcription work that's done. It doesn't add a whole lot of value to the consultation either.
I understand where you're coming from. The problem is not if they decline. That's logical to write it down. But what if you give them that information? Are you not obligated to write that down, or you didn't give it?
Well, take that thought one step further and say you give it and you document it. Are you responsible for them to understand it
No.
and to follow it?
But if there's a charge filed against you, and they said they didn't receive it, and yet you gave it, if you didn't write it down in the chart, you did not give it.
Okay, good point.
Make a suggestion. So when we look at record keeping 2032.3, item 12, this is what's required to be in your records. All medications and treatments prescribed and dispensed, including strength, dosage, route of administration, quantity, and frequency of use. If you didn't want to put this in this particular section, you could add to 12 consultation. So you basically just check a box that you consulted with your client.
And some of the information in this draft language we're discussing is also in written prescriptions, 2032.2.
Right.
In fact, quite a bit of it.
I mean,
Right.
So it's
my
kind of duplicative.
sorry. My challenge is if I prescribe steroids and then the owner's mad because the dog's drinking and peeing like crazy, and I wrote in the file, consulted regarding steroid side effects, but they say, well, you didn't tell me that. I mean, are you going to have to spell out in your consultation everything you said in your consultation? That's, if you just check a box and said consulted regarding drug and check a box, that's not going to satisfy the letter of the law, is it? So I think that this whole thing about the documentation of the consultation, I'm worried because it actually doesn't clarify anything other than it creates this minimum standard, but it doesn't help anybody, either the client who says I didn't get the information I needed or the veterinarian that said I gave you all the information you needed. And I want to make sure they have their information, but I also don't want to have to sit there and write down every potential side effect of every drug. for all the times I prescribe. So what do we need to do there?
Well, then, Dr. Quinn-Ford, you need to say, nothing contained herein shall require a veterinarian to state in the record with particularity the specifics of the consultation period.
Wow.
That's what you need to do.
No.
I mean, if that's it, relieve the veterinarian of the obligation of doing that explicitly.
The only way to avoid that quandary, I mean, what I hear you saying is, what you wrote in the record as discussed side effects, what's inherent in that is that somebody recognizes that you know what those side effects are. And the reality is, we don't all know what all the side effects are, not even the common, however the language was, severe ones. And stuff happens. What Dick said about, I mean, that standard, if it isn't written down, it didn't happen. And what Val pointed out about electronic means, many of the practices that I'm in these days, everything is emailed. Discharge instructions are emailed. It's so much easier to provide a hyperlink. And then obviously you follow that with if questions, call, da-da-da-da-da. And sometimes it makes for a very long email, but some people really want that. Many don't. But I think our problem, one of our problems is we can't tell who those are. We can't tell the difference between those who want it and need it. And then sometimes that population changes in the course of the case's progression or devolution, as it were. When things start to go bad, people start paying more attention. So I think in the cases where electronic means are possible, it's unequivocally superior for the client, for the pet, certainly easier for the practice. But that isn't, that's not the real world, not yet. We're going there.
We've got Anne Marie, Christy, and Val.
So Dr. Pollard, to your point though, I think that's why it says shall offer, so you do know. So in A, it starts off, shall offer. So that just says, do you want it? If you want it, I can provide it to you. If you don't want it, I don't have to provide it to you. So this doesn't mandate that you do it, it mandates that you offer it. So then those clients that aren't interested in receiving all that information, you wouldn't send it to them. Where we were getting stuck is, how does the veterinarian confirm that they've offered it? It's not confirming what you said, because there's nothing in here that requires you to document everything you said. You just have to document, with the language we have here, that you provided it or they refused it. And you're absolutely right, that doesn't guarantee that the information was good, bad, or otherwise. It's just that you did something. So I don't know if it does help the consumer, except that now there's a heightened awareness that as a veterinarian, you need to be prepared to provide drug counseling if requested.
And I'm with you because I'm more concerned. You don't want to get, if you get too detailed, it's like, okay, well, I went through all of this stuff, but I happen to not document, even though I said that your pet may urinate and drink more frequently, but I didn't document, but I documented the other 30 things that might happen, but I missed documenting this one thing instead of just putting the side effects of steroid use. It's that one thing that you left off, but because you documented the other 30 things, you didn't document that one thing. You're actually in more trouble because you listed all of the things. So you're better off not listing the things and saying documented side effects of steroid use. Even you said it, you just didn't list it.
Or you could just say consultation given.
I know, that's my point, is that we're really, this is just, it really comes down to being an intelligent veterinarian and documenting and just, but not mandating what is said. So.
Val?
So I've read this language a lot of times, and it just, we did want it in here because we were trying to protect the veterinarian, but as I read this, I'm curious to know if Tara thinks that if you just do the first sentence, if it's refused and you document that, does that automatically imply that if it wasn't refused, that you gave it, and leave it at that? See where I'm going? So the client refused it, so you didn't do it, but if they didn't refuse it, then that automatically means you did it, right?
No.
No? That doesn't work?
I think if you document client refused, great, that's information. If you don't document anything, then we have no idea what
Then you
happened.
don't know if it was even offered is the problem.
Right, so really what should be documented is just consultation, oral or written, provided.
And what about if the
Or
client refused it?
Right.
Okay.
Perhaps we could just write in an extra sentence, just stating that contents of the oral consultation are not required to be documented. Something like that, where it's clear that if it's provided, but then there's no additional specificity as to what was discussed, the vet is not in trouble. They're complying with the new requirement to provide consultation. We're not trying to have any gotcha moments because somebody, forgot one side effect.
Yeah, we were trying to not be overly prescriptive and yet try and make sure that the veterinarian had something in the record that say they did or didn't do it. So thank you.
I think, ultimately for the veterinarian and RVT and VA being required to check that box or document it, it's a reminder. Oh, I forgot the oral consultation. Do you want that? Offer, it's the offer. I think that's why it's important to have that. I think a lot of hospitals and premises are doing the electronic records more and more. So when that prompt is in there, consultation provided or offered, click, you remind yourself that you need to do it rather than just checking the box for refused.
Got it.
Well, what I was trying to do was combine these two into one, and
I think you can.
I think we have to, I think we have to do both sides of it.
By saying a consultation, it shall be noted in the medical record if a consultation is provided
Or refused.
or refused. And then Tara was suggesting we delineate between written and oral consultation as well.
I'm not sure we need to.
Okay. Yes, Anne Marie.
So I read this a little different. If you're documenting that consultation was refused, the only way you can document that is if it was offered in the first place.
But what about all the times that it was accepted
Right.
or not offered at all?
Right. I hear
And
you.
that's what we're really concerned about, is not offering at all. Because
So-
otherwise we have half a record. We have all the times it was rejected.
Right. So devil's advocate, because this all looks good on the front end. So on the back end, when we're doing enforcement, and we get a case, and our consultants are reviewing the case, and the client says, the veterinarian never told me anything about this drug, right? They said that they gave me consultation, that let's just say the example is, the consultation was, if the dog's throwing up profusely, call back. The veterinary, we get the records. In the veterinary records, it says oral consultation. So at that point, the board is in the midst of a he said, she said situation, which is, I provided oral consultation, I checked the box, it's in the record, I said it. Client says, the only thing they said is that the dog's throwing up profusely, I need to call back. So then it's up to our poor consultants to decide whether or not there was was it substandard care? Or did it not meet a standard of care because the veterinarian clearly should have said more than, if the dog continues to throw up, call this number. I know that you can't write everything down. It would be impossible, it's impractical, and you couldn't see the patients you need to see and provide the services you need to provide. I also understand what you're saying. Checking the box isn't getting us anywhere, because I don't know what checking the box really means then. I can't tell you from an enforcement perspective, just because you checked the box, that you told the client pertinent information that could have prevented that animal from ending up the way the animal ended up. So I think this is one step closer to a reminder, as Tara pointed out, that the veterinarian should be providing drug information. I don't know that it really helps get us at our end goal, which is truly informing the client about the drugs their animal's taking. Because unless you are going to be so prescriptive that you say you have to provide any literature available or relevant to adverse side effects, species-specific, contraindications, whatever it may be, it's not going to help us from an enforcement perspective. What it does do is remind the veterinarian that it's part of your obligation to your client. I just want to point that out, that this doesn't really go all the way.
Christy?
And I see, outpatient, this is just a perfect example. Owner comes in to pick up a prescription that's already, the doctor has talked to the client on the phone and has, written a prescription for them, and they come in and they go to pick up the prescription at the counter, and the receptionist is going to check them out. And yes, the doctor has talked to them about the prescription. How much consultation has gone on? I would assume there is consultation that has gone on. But then, in a lot of practices now, then they get a stack of papers, unfortunately, about the medication prints with them. I don't know, do they read it or not? Again, that's up to them. So that's another area that, we make assumptions that they're going to go home and read the information, but I know I don't. So that's another area that we have to make sure, we have to make a point of saying, there is information. It's in the veterinary profession that it's just, we have to, when this goes out, it has to be known.
Dr. Pascoe?
John Pascoe, UC Davis. I see the conundrum here as we're trying to marry and mirror what happens with a physician and a pharmacist. So when you see a physician, they talk to you about the drugs that they're going to prescribe, and they talk to you about potential side effects of those drugs. But you don't sign anything, or at least I've never in my experience had to sign anything with the physician. When you go to a pharmacist, you're given a stack of information. And at least at Rite Aid, you have the opportunity to click the box that says you decline consultation with the pharmacist. So I'm wondering if part of the solution to this is, at the time the client, if we try and put it in the same context, I'm not sure about the phone-in one that Christy was just talking about, but at the time of discharge, the client signs or initials something that says, I was provided the opportunity for I was provided information on the drugs dispensed or prescribed for my pet and offered the opportunity for consultation. And they sign something dated and it's done. And then you get around how much information, what was specifically said. They're acknowledging that that interaction took place. That's my thought.
And then potentially with a follow-up in Christie's scenario, when you go to, perhaps lab results come in several days later, then there's a prescription written the client goes into the office, and when picking up that prescription, they could then sign the form, I decline or I request. But just making sure that there's continuity between, it's not just on the discharge, but it's when they're picking up the prescription, at the very least, from the facility. But, you know, question mark on when that prescription is called into the pharmacy.
Okay, Jeff, Dick, and then Jennifer.
Christy touched on it in the comment you made about the volumes of documents provided. That can, you know, work to our detriment too, I mean, to the outcome of the case. And I don't think, I mean, it does, we chuckle about compliance, our own compliance, but it's true. We really don't have very good compliance, neither in the human world, certainly in our patients' case. So I don't know that more is better, and sometimes more is arguably worse because it makes them perhaps more confused. I also, the last point I want to make is the documentation of the offer for consultation or the signed discharge instructions, whatever you want to do, having a client be given the opportunity or given the information and then sign off on it, I think is very valuable. It both, I think it CYA on the veterinarian's point of view, but I think it also implies to the client that somebody thinks enough about this to make me want to make me sign off on it. I think that's important too.
I'd like to go back to Anne Marie's comment because I'm not sure what she said or where she was going on the enforcement. And unless what you said is written down, I don't know how else you can enforce compliance.
So it's like anything else that isn't in the medical record, right? We're talking about this being some sort of notation that there either was consultation or it was refused, but simply just that. That doesn't really help us from an enforcement perspective.
So yeah, that's what I'm getting at.
Yeah.
What are you seeing as a requirement of this?
I don't know that you could. I guess my point is this just gets us one step above where we are today, making it known to the veterinary profession, community at large, that there's an expectation that you're having this conversation with your client about the drugs you're prescribing. It really doesn't give us more information from an enforcement perspective about what that conversation was. Because again, we'd still be in a position to make a judgment call. Veterinarian is saying, I told him that there was adverse side effects. Client saying, I didn't get that information. They just told me to call back if this happened. So helpful in that it becomes a standard of care, but not so helpful because we're still at the mercy of what we don't know and two parties saying one did and one didn't. If you're providing written documentation, that's a CYA, right? If you're handing the client written documentation that's available, you then satisfy, I sent them home with or emailed them information about the drug from XYZ drug company. So clearly that's going to be to your advantage if there's ever a question about what conversation you had with your client, is that you actually provided literature. That may not always be possible. I guess my point was, you know, this was brought to the legislature as a means to educate the consumers about what drugs are being prescribed to their pets. And if it does enough to remind the veterinary community it's an obligation, it's one step closer. I don't know how we can get further in that continuum of what information is provided, because you'd have to document it in order for that to be substantiated. And I just don't see that that's practical, right? There's an impracticality piece to all of this that we need to be mindful of. It would be helpful to have all that in the medical record, but you'd be able to see 3 patients a day. So what would not be helpful are all those patients that went untreated. So that doesn't seem like a reasonable compromise. Plus, you'd probably all be out of business. So this is just one step. So my point was, it's not a cure-all for what we deal with today in terms of looking at cases and trying to figure out what communication actually occurred. We're not going to know much more from the medical record other than it was either refused or it was offered. And that was just my point. I don't have a great solution for.
Jennifer?
I like the idea of modeling ourselves after Rite Aid. We have a similar policy. We were having an issue with compliance with keeping e-collars on the patients after surgery, and we started to include on the authorization consent form a box, I decline the e-collar or I accept the e-collar. And it kind of woke the client up a little bit. Wait a minute, what am I signing? And it covered us to know that we did offer and inform them that they had to wear the e-collar. So, yay, Rite Aid.
So we have two pathways here, and one is this notation in the medical record that's kind of set forth here, and the other is the potential that we actually turn that around and we offer the client needs to check a box that they were offered consultation or not.
So an acknowledgement.
An acknowledgement.
So you can change this, and it might be, again, to your benefit, to change it to veterinarian shall provide a client acknowledgement form at the time of dispensation or prescription, acknowledging the client's been offered, drug consultation. However you want to word that, you turn it into an acknowledgement.
Nancy?
I just wanted to remind everyone that this is the result of one person's complaint. And you certainly would be aware, is this an enforcement issue? Have you had a lot of problems with this? Because I'm hearing Christy, and I've heard other people who are medical professionals all say they threw those things away when they got them from the pharmacy. I'm not so sure that most clients actually want pages and pages of information. They want to know how to give the medication. They want to know what the obvious side effects are going to be, and they know what to do about it. And many veterinarians have for years been linking with every drug that they dispense on the receipt, you link the directions on how to give it, and the normal side effects that are expected. And that's it, and that's what clients want. This particular client wants an encyclopedia on every drug that's given and wants to be, to participate in decision-making about what drugs are offered to his pets. But I don't think the average client wants that. And they get confused and they throw it away just like we do when we go to the pharmacy. So I think we want to make this as reasonable and simple as possible to satisfy the requirement to inform clients, but not to then go overboard because one person feels that, they should get an encyclopedia every time their pet gets a medication.
Well, and so what is reasonable and simple?
Well, personally, I think just linking normal side effects and what to do about them on the receipt is good enough. But if you're going to link to some other article that has a lot of information, for people that say they want that, I suspect that most people are going to say no to the consultation because they want to get out of there.
I mean, the big frustration or concern here is idiosyncratic reactions, so you can give them all the best information in the world. And if the animal has a weird reaction, they have a weird reaction. The other thing is that all those times that I've gotten my own medication at the pharmacy and I checked no to the consultation, I never had my physician go, gosh, John, you never took that consultation. It's not in my medical record, okay? It's in the pharmacist's record, but it's not in the medical record. So we've spent a lot of time here on E and F at this point. So what do we want to do with these two pieces? Because we already have all this language up above it, which has already created a mandate, if you will, for us. And we have this obstacle about documentation, which isn't going to help enforcement very much, from what I've heard. I don't know that it clarifies anything. So one option would be to strike all of this out, these two, E and F, and just keep moving forward with what we've got here.
Nancy's comments made a lot of sense.
Well, no, it's not clear, honestly. I think that at this stage of the game is where the rubber meets the road, so,
I barely.
yeah.
I think that we need to make this simple. I think that it is complicated. And we are making this extremely complicated.
Right. Totally.
That's my opinion on this. And I understand, I think that we need language. I'm not saying we don't need language. But I think that this is complicated language and we are making this very difficult for the veterinarian. And so that's my concern. And the more language we put in, the more difficult we make it, and it makes us have to go, okay, well, because we put this, we have to put this, and because we put this, we have to put this. And so that's my feeling on it. But I do understand that we were required to look at this, and so that is why I'm very respectful of this, and I want to make sure that we examine it.
I can guarantee that if there is an enforcement issue and we eliminate E and F, it's still going to be required. Because if you haven't documented this, everything up above there, you are going to have an infraction. So I think we should keep it simple and up to whatever software the company has and or the clinic has, and if they don't have any computerized system, they're going to have to do something in writing and leave it up to the individual, but in some form, maybe a simple sentence of the consultation or declining the consultation needs to be documented in the medical records or something like that. Because we're saying, I mean, we need to say it because we're going to require it. If it's part of the regulation, it has to be documented. You can't get away with saying, well, it didn't tell us that we had to do it.
It shall be noted in the medical record if a consultation was provided or refused.
Yes.
Okay?
So just as a point of background, this part about noting in the medical record did not come from the consumer. This is something, I just want to make sure that the consumer's interest here and the committee's interest was not so much about, obviously, the veterinarian being able to CYA. That's not what it was about. So this was plugged in, I believe CVMA brought it up, CVMA brought this up in the mediation because if it's going, as you mentioned, if it's going to be considered a standard, how do we prove that we did it? There's many things that you do. I'm just going to make a blanket statement that are required of you as a veterinarian that don't get in the medical record. You don't have to have something in the medical record when it comes to whether or not you provided consultation. You don't. Because if you're clearly documenting everything else above, the prescription, warnings of side effects, whatever, you're providing that, you're saying everything else above, dosage, form, duration, use, side effects.
And I'm doing that orally.
Well, you're writing a label,
You're writing a
script
label, you're
talking-
having the conversation
You're
with
not having
the,
the side effects on the label. There's a lot that you can't put on the label that's required. And if you, if you're not going to enforce it, I'm okay with that. But,
I mean, if in fact we got a complaint and there was no consultation provided, right? The veterinarian says, yeah, I gave him a label, I told him, I prescribed the drug, told him how to use it, and that was it, then yeah, that'd be a violation because you didn't offer consultation. Now, if they said I offered it and the client refused it and the client said I'd never refused it, well, what I would do as a veterinarian is probably provide something in writing that I could show you that my standard protocol is to provide this literature for anyone that I dispense a drug to. But standard of care in terms of what you do as a veterinarian is not all documented in your medical record. And I know that's a specific challenge for this profession because on the human side, you're talking to the people. We're not doing it here. This involves the client, but again, I just want to point out, this didn't come from a request from the committee or the consumer. This was something that during those negotiations, it was more about the liability or onus on the veterinarian to prove that they did what is suggested here. Now, if it's, you feel it closes that loop and gives some necessary coverage, then you can require some notation in the medical record. But I think that's what we're struggling with, is what does it really do to satisfy that you've done your due diligence? Because I won't know, nor will my consultants or my analysts, whether or not the information you provided was appropriate, did anything to help that client make a good decision about when to raise the red flag because there's a problem. So all it does is satisfy that you offered it, if it's notated in the medical record. Now, again, that's the recommendations of this committee, that you think that's reasonable and you feel that it's necessary so veterinarians aren't being accused of not doing it, then that's a recommendation. But it isn't coming from outside influences requesting that that be part of this proposal.
So I offer, in lieu of the language in E and F, it shall be noted in the medical record if a consultation was provided or refused. We have some level of inner peace with that, and we can move on. Okay, yeah. Well, you're way ahead of the rest of us.
I was good with that.
So we are now on to, we have skipped G, because G does not exist, and we are on to H1. In every fixed veterinary premises, there shall be a notice prominently posted in a conspicuous location indicating the consultation specified in A and B that must be offered to the client or his or her agent. The heading of the notice shall be notice to consumers. Okay. Yes.
I know we probably have to use the word consumers, but I much prefer clients.
Yeah. Do we have to use consumers?
I don't know.
No, not necessarily.
Yeah.
Well, it's consumer protection, so I
Yeah.
assumed it was a,
Yeah.
but I think I would prefer calling them clients.
Well, let's try it.
Okay.
Okay.
On that point, I'm just wondering if there, just to be consistent, if there are any other notices required to be posted in a veterinary facility that this could be added to?
There's about 32 of them.
Yeah, so
Perhaps,
they say client, it's just like VCPR is veterinary patient-client relationship, not consumer relationship. So I think there's some precedent there in the Practice Act for the term client.
as long as it's consistent.
Yeah.
Dr. Klingberg?
Yes.
Before we launch into a lengthy discussion about this, I don't think there should be a notice at all.
Okay, and your reasoning?
I think it's just another burden. It's the response, we've already tasked the veterinarian with offering to provide this information. That's enough. It's the responsibility of the veterinarian to do it, to offer it. And another posting, I just don't understand it.
The poster is if you would not have to offer.
We can't hear you, Nancy. Why don't you come up here? Thanks.
I think she's entirely right that the whole purpose of a poster is to initiate the conversation, to inform the client that they have this right. So if the veterinarian is already obligated to do this, you don't need the secondary backup of a poster to make sure that the veterinarian does it, just in case he forgets to tell the client. If you remove the veterinarian's requirement to tell the client and just leave the poster and say you have a right to ask the veterinarian, then remove the obligation that the veterinarian has to offer it. You don't need both.
Well said.
Yes, Jennifer.
I agree. Dr. Sullivan had mentioned there's quite a few notices. At some point, it just becomes wallpaper, and the clients don't have time to look at all of that while they're in the lobby. And Nancy makes a good point. It's already required that we do it. The notice seems redundant.
I agree with that.
However, the person who.
Can't hear you, Nancy, sorry.
However, Mr. Stube, I believe, is feels very strongly about the poster, so.
Well, I
that's
think
just
we'll hear
something-
from him in a minute.
Yes.
Yeah, yeah.
Oh, he's here, okay, he can speak himself.
Mr. Stu?
Salomon Stoop, the Lead Initiative for Pet Protection. Thank you all very much for all this time that you are spending with this, to all of you and to all of you too. Yes, I feel that the consumer has that it's important that the consumer know that if he or she wants to ask for something, that he or she can ask for that something. It's a simple principle. Sometimes people, when they bring their pet to the veterinarian, are very tense and nervous. And a little reminder there in a readable font can help. This is a comment that actually comes from a consumer. Thank you.
Okay, thank you.
He just made a really important point. I unfortunately might be proving removal of the language. If this was about just allowing the client to request information, I think a notice would be necessary. This regulation, on the other hand, requires an affirmative action on the part of the veterinarian. They have to offer it. It's not just about you have the right to request it. So because of that difference, that the veterinarian has to take action first, it's not just a passive right that the client has. Perhaps the notice isn't necessary for that reason.
So we can eliminate the notice because it's not, because we're required to provide this information? That's what we're saying?
Yes, that's been proposed.
I like that. I mean, I think that there are a lot of notices, and if we keep putting notices up, it's kind of like handing out the information. If we continue handing out so much information, they're not gonna read it. If we continue posting the notices, they're not going to read the notices because there's so much. So that's what my fear is.
Yes, Dick.
This is a regulation, and it could be revisited in 4 or 5 years, and if enforcement sees that it's not being done, then maybe the notice can be put forward.
Okay.
That's the benefit of a regulation.
Good point.
So I heard from a majority of the committee, I think at this point, that seemed to be speaking to eliminate the poster, the notice, I should say. And that is H1. And then I believe then that H2
It's the rest
and
of
then
the, yeah,
A, B, all of it
Yeah.
are all part of that notice.
yeah. I'm looking for the other notices in here.
The question was the other notices. We've got the animal abandonment notice, and then we've got the after-hours care.
Which
Okay.
is in the minimum standards, right?
Yeah.
In emergency care,
There it is, okay.
in the notice of after-hour emergency care.
Yeah.
And then we have to have a notice of toxic
You find it?
elements within the premises.
Your radiology equipment notice.
Radiology, but also toxic insecticides. And
Oh,
we have to have a
insecticides.
California poster of toxic.
Proposition 61.
Oh, but that's not under our minimum standards.
No, but it's still a
It's
notice.
requirement, yeah.
Licenses have to be noticed. I mean, we got a whole wall full of
Display
them.
of licenses, yeah.
Yeah.
Okay, so at that point, are we ready to vote on this, to accept this as amended?
You mean to move to the board?
Yes.
So move.
Second.
Second. Discussion amongst the committee?
Will it be forwarded to the board at their meeting tomorrow?
No, October.
All right, thank you.
Yes. Any other discussion from committee? Discussion from the audience? Yes, John?
Just have two comments under A5. I'm just wondering whether there should be, the word species should be inserted in there somewhere. So the way it reads at the moment, I would interpret that the veterinarian is required to provide all information on everything. And if we're thinking about it in a human context, again, they're dealing with a single species. And we have so much species individual variation that I think it should be more specific. And then in B, I'm still struggling with the when available, because let's say that there's an adverse side effect reported in some Russian journal that most libraries don't have, that's available, right? So should it be something like when readily available, or I would reasonably?
Yeah, they do use that reasonably.
Okay, and your first one, where were you wanting species to be?
Number 5, A5.
Where?
A5.
So, if available, precautions and relevant warnings regarding specific species provided by.
Well, I was trying to tie it to that individual. Pet, whether it's a cat or a dog.
Well, because it is A5 and A refers to an animal patient,
Patient, yeah.
So you feel it's.
I think it
Yeah.
encompasses it. Yeah, thank you.
I have a question then. Would most drug manufacturers have information for species? Okay.
Yeah, for certain drugs. Yep.
Did we somewhere in here put his client acknowledgement? Did we add that?
Be the title of the bill.
Well, we took out the poster, so that's where it was gonna be noticed to clients, but that's been removed now.
Couldn't be the title of the bill.
No.
Title of
No,
what bill?
signing, the client acknowledgement where they sign. You put that.
It shall be noted in the medical record if a consultation was provided or refused.
So the acknowledgement did not.
It did not get in there.
Yeah.
Okay. It's the new B.
Okay? Discussion from the audience. Call for the vote.
Dr. Klingborg,
Aye.
Dr. Pollard,
Aye.
Dave Johnson,
Aye.
Christy Pulowski,
Yes.
Diana Woodward-Hagel,
Aye.
Jennifer Laredo,
Aye.
and Dr. Sullivan.
Yes.
Motion carries. 10-minute break. Agenda item number 9, discussion of protocols for the use of sedatives in emergency situations. So as you recall, this is agenda item that's taken kind of a strange course. It started in our conversation trying to differentiate between anesthesia and sedation, and in the end it has morphed into a conversation about sedating, allowing RVTs to sedate animals under what we would consider to be urgent but not necessarily life-threatening / emergency situations. And we were talking about some of those situations that happen where you've got the badly matted cat that has the infected skin, and while that may not seem like it is a life-threatening situation, it could be if that is a badly matted cat that is loaded with maggots. Or you've got that husky who has bitten the cage and his jaw is stuck and there's not a veterinarian present, but a sedative is needed to be given so that husky can be safely unstuck from the cage. And so Dr. Druses and I came up with this language that's in front of us here, and you've got this language here, 4840B, which is underlined. So reading the existing language on 4840B, registered veterinary technicians may perform animal health services on those animals impounded by a state, county, city, or city and county agency pursuant to the direct order, written order, or telephonic order of a veterinarian licensed or authorized to practice in the state. The new language would be in accordance with 4836 and pursuant to direct orders or written protocol of a California licensed veterinarian employed by the impounding agency, a registered veterinary technician may sedate impounded animals for the relief of pain and suffering and render non-surgical aid to the animal patients in the absence of a licensed veterinarian. I think that we've got language in 2069 that also is there. This is the more recent language that we had discussed. Yeah, that's already been approved, so.
It's there for reference because I want to make sure that we keep in mind what we had already agreed upon in regulation, and if we are, convinced that we need to change statute to expand the authority, I'm not so sure that 4840 is the best place to put it when we're talking about emergency care or care in what we would consider kind of urgent situations. I also want to bring to mind, or just point out that in SB 546, one of the proposals early on was to strike this language at the end of 4840.5 where it says emergency aid. The proposal was to strike after to sustain life. So basically, emergencies for the purpose of the section means that the animal has been placed in a life-threatening condition where immediate treatment is necessary, period. And the proposal was to sustain life was going to be removed. Otherwise, what the MDC recommended and the board voted on in 2069 may have been lacking authority. Because this was to, remember, take care of the rodeo situations and what have you. So I just wanted to point out to the MDC, since we're talking about emergency care, sedation, that in the new SB 547, we've reminded the committee that this was supposed to be taken care of, so it should be taken care of this legislative session. I think everybody kind of forgot about this, and so I brought it up again because I don't want us to try to move forward with 2069 and then have a statutory authority problem because this sustained life language was there.
David.
Thank you. Conceptually, this is needed. As we have discussed, the badly matted cat and the stuck jaw in the cage are just two of dozens of scenarios that I can tell you exist on a regular basis where animals need emergency aid, but it's not life-threatening aid, and you improve their quality of life by sedating them and taking care of the problem. We're talking about collars that are too tight, things that are stuck in the mouth. I had a cat with Chef Boyardee spaghetti can stuck on its head that had to be sedated to remove the can off of its head. So the lists are just endless. My concern is I never like going to statutory change if you don't have to. And I really think that since there's already board authority to adopt job tasks and regulations and levels of supervision, and we have the concept that in B that a registered veterinary technician is already authorized to perform the services, we'd be better off going to 2036 and creating a 2036.25 in the regulations, a new section, and entitle it Animal Healthcare Services as opposed to Animal Healthcare Tasks, and then drop this language in there. And I just think it would be better to have a separate regulatory section with this language that ties into the task type of sections. And then if something comes up in the future, when we think of something else that registered veterinary technicians need to do in animal or in an animal shelter setting, then it can be dropped into that section in the future. So I would propose we create a new section in the 2036.25 and drop it in between. And I think it'd just be a lot cleaner.
Any discussion?
Again, unless legal counsel doesn't think it's a good idea.
Can you clarify again what section you're proposing
Well,
to?
2036, in the code of regulations, is animal health care tasks, where they already outline things for RVTs that they can't do and the things that are exclusive that they can do. And they're called animal health care tasks. And then just taking the language from 4840, they're called animal health care services. So that's where the language, I'm taking it from. And then what was proposed here, this new language, it belongs better in a regulation than it belongs in a statute. And I just think that allows us then room in the future if something else comes up that we think of. Not finding it?
Yes, Nancy.
I think we should remove the impounding agency. I don't see why this particular amendment would apply only to RVTs working in a shelter setting. I think that this equally applies to every other setting in which RVTs are working. An RVT who's working on a Sunday, working after hours in a private practice, who comes upon an emergency on the road. Anytime that an RVT is confronted with an emergency that is not necessarily life-threatening, but is certainly potentially very harmful to the patient.
So you would propose that we change the language to say that it would remove the, from employed,
Just to remove employed by the impounding agency and just
and then
say-
you would also remove impounded in the next
Yes,
line, say may
right.
sedate animals.
Yes. And I think David's suggestion is a good one, to move it into the 2036. And maybe you still need to do something with 2069 perhaps. But if you do that in 2069, then you have to redefine what an emergency, because emergency still says, the definition of emergency is still called life-threatening. Now, I suppose that you can presume that a cat with a can on its head could eventually kill itself or die from starvation if we did nothing. But when you come upon the situation, it isn't necessarily life-threatening.
Nancy, I don't see a problem with taking that out. It just prompts the discussion of, in general, are people only comfortable with this occurring in a shelter situation, or are they comfortable with it occurring in the entire profession? And that's just a discussion we're going to have.
Right.
And I see the language.
Well, we
both
already
ways.
talked about it. It started because of rodeos, and our RVTs being able to administer emergency aid in a rodeo, and it wasn't necessarily a life-threatening situation. You have an injured animal, and just in order to do anything to it, you have to sedate it before you can work on it.
Okay, Dick.
I guess I'm lost. I'm not sure why all of this isn't already, it would not be covered in the new language on 2069. I guess do we not already have enabling statute to give us the authority to do number 9 in 2069? Doesn't that cover everything?
Yeah. And you may be right, Doctor. I wasn't aware that the to sustain life had been taken out. So that's why I think this got put in as a separate section, because these are situations where the animal really isn't in a life-threatening situation. It's in a compromised situation that action needs to be taken, but it isn't necessarily life-threatening. And so that's why I think it's in two different places. Now, if the word "to sustain life" gets taken out of there and you want to make the interpretation of number 9 under 2069 to be all-inclusive, I think that's a great idea. Yeah,
I think that's the cleanest.
yeah, and I have no problems with that. If that will cover it, I just wasn't aware of the "to sustain life" issue.
If we remove that, or we're in the process of removing that phrase, do we still need the new language in 4840B?
No.
I don't think so. But this 4840.5 language, this sustain life, I wasn't aware of that somehow. I missed that conversation. So I don't think it happened here, did it?
So it happened when we were amending 2069. So we amended 2069, and out of that, you made a recommendation to the full board, but council was looking at your statutory authority saying, hey, we may be in trouble because 4840.5 goes further to say it can only be done if it's necessary to sustain life. So in order for this to work, that would have to change. So at the board level, we said, okay, we're gonna move forward with a series of requests of the committee. And one of them was, in order to implement what they wanted us to do with regard to rodeos, we said we need to take this out. So it was kind of coupled with the sunset review follow-up.
Okay.
But the discussion, we had the discussion here, the language wasn't changed here.
So, yes, it seems to me like that is the cleanest
Necessary.
what's been proposed there. Yes, Diana?
I like this immensely. I think it's well-written. I think it's just in the proper place. It flows naturally from the first sentence and elaborates on it. If Dave wants it in a regulation to apply more generally, just take out the shelter aspects, the impounding language, and have it there. But I think it's great. I'd make only one suggestion, and that is that do you want to have pain and suffering? You could have pain or suffering and be a little bit more flexible, you see. But I like it immensely. I think it's great.
Christie?
But it's not necessary.
What's necessary?
It's not necessary.
But it's elaborative. You know, it says something. It says something very specific and important. And I assume a situation that presents itself with some regularity.
Dick?
Yeah, the problem is we'd have to go back to the legislature for this, whereas the changes that we're making in 4840.5 is already in the process, right? And where does the sentence end on that last sentence?
It ends at necessary. Immediate treatment is necessary, period.
Okay, period.
So, sorry, John. Quick question. If you believe that 2069 satisfies what you're trying to accomplish, I just have a question. This seems to refer to in the absence of the licensed veterinarian, right? So the veterinarian's not there, the RVT can sedate the animal. Under 9, it does require direct communication with the veterinarian or otherwise authorized to practice, the veterinarian authorized to practice in the state. So if direct communication cannot be established, the RVT may administer the drug in accordance with written instructions. Would that provide
Yeah.
enough? Okay.
Yeah, and
Right.
the
So
most
the protocols.
right, and the most
Okay.
common scenario that we use, tremendous amount of dexdomitor. A lot of these animals just need a little dexdomitor to calm them down so you can pull the collar off, shave them down, get their toe caught out of a grate, whatever. And yes, there'd either be a written protocol for it, or they're gonna be on the phone asking for permission to sedate. That's reasonable.
And I would recommend that we change employing veterinarian here to supervising then, because you're at a shelter, the veterinarian may not be employing you.
In 2069.
Yeah, if we're gonna move this language to 2069 so that we're saying, really, we can satisfy what 4840 is trying to accomplish by looking at what we did with 2069, then we may wanna consider that in accordance with written instructions as established by his or her supervising veterinarian,
Yeah.
because employing may not work for the shelter environment.
Sounds good.
So looking at 2069, I see an RVT may render the following life-saving aid and treatment. So when I'm looking at this, I see life-saving and it looks like it pertains to aid and treatment. So when I go down to 9, it's possible, I mean, I'm thinking that perhaps you're contemplating situations where it's not life-saving because we keep talking about 40.5, removing to sustain life. So to the extent that it's not about saving or sustaining life, 9 potentially is not appropriate to be, for placement under 2069.
It says life-saving aid and treatment.
Right, well, that's the question. Is it life-saving aid and life-saving treatment?
Right.
Or is it just life-saving aid and treatment, which I don't think it is because it's emergency animal care.
I would argue that application of temporary splints or bandages to prevent further injury to bones or soft tissues is not life-saving, and that's there.
That's a good point.
It's been there forever.
I was gonna say the same thing. I think it's easier to change that part of it than to add a whole new section. Because it does fall under emergency care.
It's
Can it just be
emergency, it's not-
rewording saying render the treatment and life-saving aid? Can you just switch those words around so that it's? Or,
Well, I think some of this is life-saving that's in there, so.
But you don't need it. It's render the following aid and treatment.
Well, the
Or just
emergency
add
is defined in
emergency
48,
or the following
40.5. Yeah.
Fine.
They render the following. Get rid of the rest of the sentence.
I can tell you, trust me. Who's to say it wasn't?
Perhaps you could do either moving treatment in front of life-saving aid or saying life-saving aid and emergency treatment.
Okay,
Yeah.
Or just life-saving aid or emergency treatment.
okay. Since we're making a change to that section anyway.
Also, under 9 on that first line, I would strike the between manage and pain. And on that fourth line, we need to insert a period after state.
Yeah, it got dropped, I wrote that too. Yeah, we'll fix the formatting part.
Okay.
So I'm a little confused as to what direct communication means. If this is a scenario, being rendered not in the presence of a licensed veterinarian, is that indirect supervision or no supervision with written protocol or telephone order? What is it?
So I think that what we're getting at here is there's always some form of supervision because they can't do anything without some form of supervision. So in the event that direct communication, meaning there's been a conversation or some sort of direct interaction cannot be established, the RVT may administer the drug or drugs in accordance with written instruction as established by his or her supervising veterinarian. So you're either directly communicating or there's some written instructions for, in a emergency situation, this is what you would do.
So 9 starts out administration of drug or drugs to manage pain or sedate. And that can be relied upon with written instructions. And then it says such a task shall only be performed after direct communication. And then it says, in the event there's no direct communication, then they can follow written instructions.
I mean, we can reorder it to make it more clear, but the general sense is here that they should have direct communication with the licensed veterinarian. But if there is no direct communication, like that's your first line of, that's gonna be the first rung, is that you're trying to get in touch with the veterinarian and have direct communication. If you cannot establish direct communication, then you go into a written protocol.
Okay, so maybe something like 9 could be upon receiving direct communication with a veterinarian, administration of a drug or drugs, in the event that direct communication cannot be established. Okay.
Yep.
So we're moving away from the language that had been offered for 4840, and I'm going to use this language that's going to be modified in 4840.5, where to sustain life has been removed, and then have made some amendments to 2069. Any other questions or comments from the committee? Yes, Nancy.
I would just like to clarify that it appears that only items 2 and 9 require a veterinarian to be involved, because those are the only ones that say that you have to be in communication. The other ones, you can perform, RVTs can do the other things without consulting a veterinarian or having a protocol.
Are you suggesting that we should put that in the, up in the first
Well,
paragraph?
as many years as this has been in the law, this is the first time I've actually noticed that.
Yeah.
And so perhaps that's not what people really intended. Or maybe they didn't. They figured, well, if an animal's bleeding, you don't want to stop and call the veterinarian, you
Right.
want to put the tourniquet on.
Well, and that, I think, was the issue, was that these things in 9
They're not as
aren't
urgent.
the same level of urgency.
Right, they're not as urgent as these other
You
things,
need
so
to
maybe
check.
that's intentional.
Yeah.
So perhaps they should be reordered, so that you have things that require communication
But don't you think
together
that-
and things that don't.
Don't you think that after the tourniquet is put on, that the veterinarian should be notified?
Yes, but this allows you to put the tourniquet on before.
I know,
So-
but I'm
So
saying
perhaps we
is-
need 2 classes.
Or it could be stated that in the introductory paragraph.
Yeah,
Yeah, I mean, if you need cardiac compressions.
yeah, you're not going to stop and call.
We could do a subdivision A that provides for, under conditions of emergency, an RVT may
Wait, there's,
render.
there's life-threatening emergency, and those are the ones where you don't call the veterinarian first. And then there's the other kinds of emergencies like broken legs and bleeding legs, and that you do call the veterinarian. So we've already decided there was life-saving aid and there was other kinds of emergencies.
Well, I think there's probably both, but which of these can you perform pursuant to written instructions, and which must you contact the veterinarian first through direct communication?
Well, you kind of put it, it's the more serious things are the things that you don't want to have to call the veterinarian for, because the animal could die while you're on the phone. The less serious things, which are serious to the patient but not life-threatening, those are the ones where you have the time to either consult the protocol or call the veterinarian.
Let's discuss with the committee.
So, I mean, basically, I'm not gonna stop and call the doctor before, performing resuscitation. I wanna be able to perform resuscitation and then call the doctor and let them know what's going on and get permission to do anything else. And I think that's kind of where we're headed if we need to categorize these are the things we need to do first. But can we call the doctor first and then apply a splinter bandage? That's kind of where we need to go.
Yeah, I think we're splitting hairs.
Yeah.
I know, and I don't disagree, I
mean,
think
this
it,
is an application of a temporary splint.
it works.
No.
It's obviously worked.
I don't see that there's been a lot of abuse of the way that RVTs have handled heat prostration cases.
I'm suggesting that A could be just clarified that these procedures can be performed under written instruction, and then a subdivision B is what requires direct communication first with a follow-up. If there's no direct communication that can be established, then they can be administered, and it's just 2 and 9.
But I don't think any of the other ones have to be even under, at this point, any kind of written protocols. They're taught to do these things in their RVT program, so they wouldn't need protocols to apply a tourniquet necessarily. So I think really what it is they can render these life-saving emergency treatments without anything from a veterinarian other than they're under the general supervision, because they have to be under general supervision when they're treating an animal. But then these 2 items that are called out are specific as to either establishing direct communication or, in the absence of that, operating under a written protocol.
So A is render now.
Mm-hmm.
B would be
Yeah.
direct communication, then written instruction.
Mm-hmm.
Comments from the committee? Yes, Dick.
With those, staff making those changes, is this ready to move up to the board? So moved.
Can you reiterate what you're doing?
So, in the packet, in the information, there was a proposal to put something under statute. The committee's decided to not change 4840, but instead amend 2069, that was also part of the materials. And item 9 would provide the authority for an RVT to sedate an animal, either under direct communication or under written instructions. So staff will go back, Tara and I, and reorder this so that the 2 provisions, which would, as they're numbered here, item 2 and item 9, would be under a subdivision that would require direct communication. If that direct communication cannot be established, it would be performed under written instruction. The remainder of the items that are already listed here in current regulation would be under a subdivision that an RVT may render the following life-saving or emergency treatment to the animal, and they would just be listed. So there'd be 2 subdivisions, a subdivision A for application of tourniquets, resuscitation, resuscitative, never mind, establishing open airways, so on and so forth, and then another subdivision that would include administration of pharmacological agents, and then down into the sedation and drugs.
You had a motion, do you need a
Yeah,
second?
we have a motion.
A second.
Got a second? Yep.
Could we add to 2069 the language that you have here in 4840B? And I've got 2 pages.
I don't, before you give them, I don't think it's necessary. I mean, we've really covered it because 4840B talks about direct orders and written protocols. It talks about sedation, and the language that we have in 9 talks about sedation. It talks about direct communication. I mean, and it has written instructions. So, I mean, they have all the same elements. And there's a brevity to 2069 that is appealing.
I'm all for brevity, but it seems like this is a specific situation. I just like to work in the shelter medicine people.
it's a good switch. The language that's in 2069 is fine.
Yes, Dick?
And I would assume that we are moving the changes to 2069 after we get the changes in 4840.5 done in statute. That information should go along with it.
I'll get it later. Just throw it again. I'll look at it.
Okay. So we've had a motion and a second. Any other discussion from the committee? Discussion from the audience? Call for the vote.
Dr. Klingborg,
Aye.
Dr. Pollard,
Aye.
Dave Johnson,
Aye.
Christy Pulowski,
Yes.
Diana Woodward-Hagel, Jennifer Laredo, and Dr. Sullivan.
Yes.
Motion carries. On to agenda item number 10, public comments on items not on the agenda. Any comments from the public? Hearing none, we will move to item 11, which is our future agenda items and next meeting dates. Our next meeting is in beautiful Fresno, California, and that is on October 17th.
So under this discussion item, and also next meeting dates, because many of you probably need to plan your 2018 calendars, is that true? Okay. So at the board meeting tomorrow, we are making a request to shift our board meetings from the typical January, April, July, and October to February, May, August, and November. And the reason for that shift is it helps us with holidays, and it also helps us with getting meeting space so that we offset from some of the other boards. If we can go through the meeting dates for the MDC, that would probably help you folks with your calendars. A proposal for February 19th in Sacramento. It is? What is it?
February 9th.
Yeah, February. Oh, I'm sorry, February 20th. It's the day after a holiday. Thanks, Dick. You're so helpful. Always willing to serve. May 22nd.
Hold on, you said that was gonna be where?
Sacramento, yeah. We don't know yet on where May is gonna be.
So May what?
May 22nd. August 21st. And November 13th, so we're trying to avoid the Thanksgiving holiday week. Correct.
Okay, anything else on that? Our assignment priorities. So we have ongoing our complaint process audit task force. I'm gonna skip number 2 for a minute. Well, I guess it's kind of 2A. Shelter Medicine Subcommittee is the subcommittee of David and Jeff, minimum standards and protocols for shelter medicine. Agenda item number 3 is the extended duties for registered veterinary technicians, same subcommittee, and we have new language to consider from CARVTA, 2 different pieces of new language. Agenda item number 4, I think that we have dispensed with, and that is our compounding. 5, I believe we have addressed as well, and 6 we have addressed as well. So those are our agenda items.
I just said we're done, we need to go home, I'm like, it was good.
Yes, Val.
So believe it or not, our premises task force will conclude its work on August 30th.
Ah.
And that includes everything under number 2 for all of those categories.
Great.
So we will be providing you lots of new work to do in the next few months.
Perfect. Thank you.
So Val, we have a meeting August 30th, right?
Yes,
Okay.
last final meeting.
Okay, so then we've got this agenda items for next meeting, which I think we discussed.
I think there'll probably be more after tomorrow.
Great. Anything else? We ready to adjourn? All right, motion to adjourn? All right, and we're out. Thank you.